What's going on, everyone? Happy Saturday. Hopefully everyone is doing well, staying safe, healthy, having a great day so far, and of course testing negative for all those viruses. It is time now for the Saturday edition of the Virus Update for Saturday, August 9th, 2025. If you are new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. There's a lot of viruses out there, and the United States and other parts of the world are dealing with a summer surge in COVID. You need to be informed of what's going on because, let's face it, you don't hear much coverage about COVID and other viruses on the news. That's where I come into play. I keep you informed with the latest news, data, and anything I can find each and every day. Want to stay informed? Subscribe down below. Give this video a thumbs up. Hit that notification bell. Share this video with anyone you know. Leave your comments down below and consider joining our Data Report fan club down below. Already, we do have several news stories to talk about today. Then we do have some of our daily data we're going to take a look at. We're also going to take a look at emergency department visits diagnosed with COVID. And we are going to also take a look at some data from CJS. So that sounds like a jam-packed video. Let's get started, shall we? In California, Los Angeles reports the highest COVID positivity since September 7th, this is of last year, at 9%, and higher than 2021. Orange County reports an increase to 11.5% as of August 2nd. So the COVID positivity rates in California are going up, and LA actually had to revise up the COVID positivity rate for the previous week. Moving on now to this. Japan, this is from Dennis the COVID Info Guy. Oftentimes he talks about several different countries and their cases. This time it's Japan. COVID cases up by 34% and hospitalizations up by 26% from last week. The Japanese Health Ministry said 21,365 COVID-19 cases were reported last week, up 5,441 from the week before, and 1,501 people hospitalized, 314 more than the previous week. So Japan is now also trending in the wrong direction when it comes to COVID. Japan whooping cough has been going up big time there as well. I did not see an update on that this week. I don't know why. Usually I rely on news sources for that. I'm going to have to find their website and see if I can figure out just what their whooping cough cases were for the past week, because they have been dealing with record cases of whooping cough. So Japan dealing with a lot of problems at the moment. COVID and whooping cough, I don't know. Is there anything else going on there? I guess we'll have to find out and see if anything pops up. Not good. COVID-19 outbreaks in Australia. This is also from Dennis the COVID Info Guide. This is in residential aged care facilities. This is as of August 7th, 2025. Active cases, 685. That's down by 19.6%. That is some good news. This is wintertime over in Australia right now, so it is dropping. It is good to see that for now they're seeing a peak. They may see another rise down the line at some point. I don't think the XFG variant or XFG.3 have taken over there yet, so hard to say what that's going to do. We'll have to keep our eyes on it. Active outbreaks there, 134, down by 15.1%. Resident cases, 474, down by 23.3%. Staff cases, 211, down by 9.8%. And reported deaths in 2025. Yes, deaths in long-term care facilities, senior living facilities, or aged care facilities, as they talk about it there, nursing homes, as we know here in the United States. It's still a thing in Australia. 347 deaths there. That's up by 5. Again, good to see numbers are coming down at the moment. Let's hope it stays that way. Moving on now to this. Back to the United States once again. Back to Los Angeles. And take a look at this. LAX travelers potentially exposed to the measles case. Yeah, this is not good. We haven't heard about measles in California in a while, and suddenly you're going to see there's 2 measles concerns today. This flight was on, looks like it was on August 2nd, and August 3rd was the time frame that one could have been exposed. Reason why I say the 2nd and the 3rd, well, it was 9:30 p.m. to 12:35 a.m. People may have been exposed. If you think that you were at this airport during this time, you might want to just start monitoring for symptoms. Not good. Also a concern in San Diego. A San Diego teen who traveled brings home a case of measles. Sounds like this was the first case of the year for San Diego. So, yes, a measles case in San Diego. And the public health officials confirmed Friday the first case of measles in the region in a teenager who recently left the country. There will be a thread that I'm going to post later today on my site. It'll be a post on my site with all of the news stories, since there are so many. Days when there's a lot of news stories, I'm going to do that. Days where it's just a couple news stories, I don't think I'm going to do that going forward. But in this case, you need to know all the potential exposure points. Here we go. Another measles case. This time, it's a measles case confirmed on Air Canada flight from Newark Airport. Yes, Newark, New Jersey, which is a very busy airport. LAX is also one, but Newark is crazy, or at least from what I have seen, from the times I've taken people up there. Newark to Toronto last month, officials say. Anyone on board the July 30th flight or in Terminal 1 that evening may be exposed. So, yes, this is not good whatsoever. Again, I'm going to have a post today. You'll be able to read all the exposure points. If I sat here and read all of that, my videos would be extremely long. Moving on now to another exposure, this time not measles, tuberculosis. And this is also out on the West Coast. Cache Creek Casino warns customers about active tuberculosis case tied to a resort. Yes, this is in Yolo County, California, is warning customers about active tuberculosis case tied to the resort. The casino says it's working with public health officials to notify people who may have been in close contact with the infected person. So this is not good. And California says the state actually averages about 2,000 cases a year. I didn't realize the number was that high there, but yeah. If you think you were at this resort recently, or maybe you were just there, please be mindful. Someone with TB was there. Alrighty, moving on. Now to this, Michigan. I don't know. Have we reported this before or not? The Lansing State Journal just reported on this. That's a website and newspaper, I assume. They just reported this on August 9th, which is this morning. And that is the first human case of West Nile in Michigan reported for 2025, where the virus was detected. For my Michigan followers, let me know. Did I already talk about this? I don't remember. It's been a very busy summer. State officials say the first human case of West Nile virus this year has been detected in Livingston County resident. It only takes one bite from an infected mosquito to cause a severe illness, and West Nile virus can become severe. It can become deadly as well. So this is a virus you want to take serious. All right, moving on now to this. This is the wastewater viral activity levels for Canada, and we will see here that COVID-19 is still moderate. Flu A is low, Flu B is low, RSV is also listed at low at this time. Taking a look at what's going on with the air quality today in the United States, and I need to refresh this, and I can tell you right now, the Northeast is doing better. Yeah, you still see some orange here, but I can tell you just by looking in the sky outside, things are a whole lot better than they were earlier last week. Still some problems back across the Ohio Valley, western New York, northern Vermont, New Hampshire, portions of northern Maine, but again, not as bad as it was. Unfortunately, though, things could get bad again, and really, this could pop up with just a day's notice at any given time. We still have the smoke ongoing up in Canada. Take a look at this. You can clearly see it here on this map, and at any given time, that could spread back southeast, so we're going to have to keep an eye. If the winds shift to the northwest, again, where the winds funnel down from Canada, say like Alberta, western Canada, if the winds come from there, then we're going to have big problems once again. We can only hope that doesn't happen, but chances are it will happen at some point. Also, the West Coast has some bad air qualities today. California, take a look at Colorado. This is about the worst we've seen yet for Colorado. Wildfires are to blame for all of these issues. What's going on here in Oklahoma, Arkansas, maybe a little bit in Louisiana? This orange here. Can't say that's wildfire smoke. I honestly don't know what that's about, so we'll have to keep an eye on that. Portions of Missouri and Kansas City as well, so that's something to watch. Georgia Could this be wildfire smoke? Honestly, I do not know. All right, taking a look at Florida. Some good news out of Pinellas County, Florida. I have been noticing over the past week there has been a significant decrease in the number of sick person EMS calls. Could that signal there's a potential peak in COVID in Pinellas County area? Well, it potentially could. More details on that when we get to CJS data, but I am very encouraged at this time. All right, let's see if Philadelphia updated for today. It is 11:43 a.m. on Saturday. Of course, you're watching this later. No update for EMS calls out of Philadelphia yet. Sometimes on the weekends they're either delayed or just don't do it. All right, things that are trending in the wrong direction would be Pennsylvania. EMS calls in southeast Pennsylvania. Yeah, unlike Pinellas County, Florida, they're trending upward here. I've been watching this get very busy. 15 calls at this time of day on a Saturday. That's a lot. As you know, the air quality, yeah, it's not 100% perfect. It's better. And look at this. Respiratory emergency. Respiratory emergency. Respiratory emergency. 3 of them. I'm concerned at what's going on. I noticed when I'm out delivering this past week compared to before I went to Maine, there's a lot more delivery requests. I actually had a comment when we did that little short the other day about IHOP being closed. Update, IHOP is open again. I don't know what the deal was, whether it was COVID or something else. Someone asked. The guy just told me, oh, we're closed today. There was a guy in the parking lot. Everyone called out sick. I don't know what that was all about. Were they actually sick? Were they just not coming in that day? I don't know. But the point being made is there are far more requests right now. And anytime requests for deliveries go up, you can clearly tell that COVID is up. And I've also seen the majority of my deliveries have been leave at door. Now, some people just like that option because they have a baby sleeping. They have dogs that will go crazy. Or it's because they're sick. And I have seen, I think, at least 2 messages this week. You know, they give you a little note, please just leave at door. We're sick. I've seen that twice this week. So I think it is an increase of people starting to get sick, whether it be a cold or COVID. And when I say cold, well, someone says they have a cold. Did they actually test for COVID? I get it. It's expensive to get the at-home test. So, yeah, delivery request up. EMS calls are up. Let's check Chester County. This was busy a little bit earlier. Oh, wow. Yeah, it hasn't changed. Okay. Sick person once. Sick person twice. Sick person 3 times. Respiratory difficulty. Stroke. Did not show it to you in Montgomery County. Hang on. There was actually a cardiac arrest call there. That's never a good thing. So you can see a call volume is going up. Let's check Bucks County, Pennsylvania. I need to refresh this. Hopefully Bucks County is not, well, I was going to say hopefully it's not busy. 12 calls. That's busy for Bucks County. You get the idea here. Things are really picking up, and it's a lot of different things, but, you know, a lot of different things can be COVID, too. So I am not saying all of this is COVID. I'm just noting here EMS call volume over the past week or so has increased in southeast Pennsylvania and the counties outside of Philadelphia. Not a good thing to see. Let's see what's going on with the hospitals. Hospitals in Pennsylvania, not terrible. We do note, though, 2 hospitals in southeast PA are dealing with overcrowding at this time. That's not good. As you know, if you've been a long-time watcher or follower of my channel, you know we have a problem in southeast Pennsylvania. See all these red buttons here? You know, all these red markers? Yeah, those are hospitals that are either not closed or just do not have an emergency department. There's a big problem with emergency departments in southeast PA. Taking a look here, Lehigh Valley's not doing as bad as they were earlier in the week when Music Fest first started. Yeah, that's a big festival that's going on. They get over 1 million people. In fact, last year, they had 1.3 million people show up to Music Fest. Yeah, that's a ton of people. Yeah, it's outdoors, but when you get that many people over a course of a week, coming in and out, yeah, there's potential for the spread of viruses. New Jersey has a couple specialty issues. Inspire Medical Center, Elmer and Mannington, both having issues right now, and those are the only 2 hospitals in New Jersey. All right, let's take a look at those emergency department visits diagnosed with COVID. I think we're just going to look at this chart, and we're going to save all the states for tomorrow because we do have that data from CJS I want to get to, and I don't want this to turn into a 30-minute video. We've never done that, have we? I don't know. Emergency department visits are clearly trending in the wrong direction here in the United States. They're continuing to trend upward. Tomorrow we'll look at all the different states. Epidemic status, I showed you this yesterday. If you did not see it, here it is. It's either growing or likely growing in the majority of the United States. No change in Maine, no change in New Hampshire, no change in North Dakota, also no change in Alaska, and no data out of Wyoming. I don't know what the deal is with that. Is there just not enough testing? I honestly don't know. Or maybe things are just not going bad. We'll see. Maine, I follow Maine pretty closely because some years we went to Maine in September. And I have noted that sometimes Maine in September starts to go up. We'll have to keep our eyes on that. Or late August into September, I should say. Same can be said for Vermont. All right, let's take a look at that data now from CJS. Reminder, tomorrow is Wastewater Sunday. We will have an extra focus on wastewater tomorrow, but I got a feeling tomorrow's going to be another busy day here as well. All right, take a look at this. We got a lot of numbers here to read. First off, Thursday numbers from CJS. Florida reported 1,285 new cases and 10 new deaths. New York reported a daily number of 757 new cases on Thursday. Puerto Rico had 972 new cases. Yeah, that's a lot for Puerto Rico. Arizona, 1,351 new cases and 3 deaths reported by the CDC data tracker. Colorado reported a test case positivity rate of 8.1%, up from 7.4% last week. Connecticut, 348 new cases and 2 deaths reported by the CDC data tracker. Hawaii, 670 cases and a test case positivity rate of 18.2%. Up like a rocket, that word is supposed to say like, and from 12.2%, as was being shown at this time last week, which was updated to 14.9% with today's update. Sometimes they do revise previous numbers for states. CDC does that as well. Indiana, 547 new cases and 1 death reported by the CDC data tracker. Kentucky, 611 new positive tests and 3 deaths reported by the data tracker. Minnesota, 498 new cases and 11 new deaths. 932 new cases reported in New Jersey and 4 deaths reported this week. New Mexico, 277 new cases. North Carolina, 322 hospital visits for COVID-like illness. The CDC shows 167 COVID-related hospitalizations in North Carolina this week and 9 deaths reported by the CDC data tracker. Washington, D.C., weekly 2-week update. 178 new reported cases over the past 2 weeks. Now for his Friday numbers, but before we do that, let's pause and take that hydration break. My throat needs it, and chances are you may not have drinking a drink of water in a while. Water is the drink of choice today. All right, I'm leading you up to a big number here. Florida, first off, their daily number, 1,539 new cases and 11 new deaths reported today. And for the week, 8,908 cases and 56 deaths were reported over the past 7 days to go along with 1,121 CDC reported hospitalizations. Hospitalizations did go up by a 9.37% from last week. However, in his notes, I didn't include that in here, but in his little spiel prior to the numbers, he did note that I believe cases went down this week in Florida, so we'll have to see. I think hospitalizations may peak soon as well. Again, I've been noting, at least in Pinellas County, I can't speak for all of Florida, Pinellas County has been seeing a decrease in the number of sick person calls every time I go to take a look at that. All right, New York reports 713 new cases reported today and 3,984 reported over the past 7 days, a 9.9% increase from last week to go along with 337 CDC reported hospitalizations and 14 deaths. And it says he uses the same source for New York had used until the end of May. The CDC provisional accounts released on Thursdays. Okay. Puerto Rico, 726 new cases reported today and 5,193 cases and 7 deaths reported over the past 7 days. All 7 Puerto Rico deaths for this week were reported on Tuesday to go along with 146 CDC reported hospitalizations. Alabama reports 106 CDC reported hospitalization and 1 death this week. These are weekly numbers now. California reports 5,910 new positive tests, a test case positivity rate over the past 7 days of reporting of 9.97%, up from 8.66% last week. 871 CDC reported hospitalizations, a 20.8% increase from what was shown last week, and 32 new deaths, including one from 2024. Georgia, 176 CDC hospitalizations and 4 deaths reported. Idaho, 261 emergency department visits and 2 deaths. Illinois, 4.9% test case positivity rate, up from 2.6% the last time they reported 3 weeks ago. 106 CDC reported hospitalizations and 4 deaths reported there. Louisiana, another 847 emergency department visits, a test case positivity rate of 10.9%. That's still going up because it's up from 9.4% last week, and 113 CDC reported hospitalizations and 3 new deaths. Massachusetts, 107 CDC reported hospitalizations and 34 deaths reported by the CDC. Mississippi, 5 deaths reported there. Ohio, 7 deaths reported. Oklahoma, a statewide test case positivity rate of 10.6%. 5 of the state's 8 regions are posting positivity rates of over 10%, with Tulsa County coming in this week at 21.6%, and Northeast Oklahoma coming in at 5%, and 1 death reported by the CDC data tracker. Apologies if you can't see what I'm reading down here on the bottom right. My camera does block that. All right, Pennsylvania, 229 CDC reported hospitalizations. Yeah, that continues to go up, plus another 17 from last week that weren't reported then, and over 100 more than 2 weeks ago. 3 deaths reported by the CDC data track. A quick note about Pennsylvania, and let's highlight where we're at. I do have it actually listed up here. I am noticing more people masking here in the Philadelphia area in southeast Pennsylvania in the past week. I'm seeing it in the grocery store. I'm seeing it in various different locations. Maybe some people that used to mask, or maybe they're going out in public with a mask on because they are sick at this time. And I'm seeing a surgical mask. I'm seeing the cloth mask. I'm also seeing the N95s. It's just a general mixture, but I am seeing more masking. Generally, the overall population is not masking, but hey, it's more masked than I was seeing before. Washington, this is the state of Washington. 126 CDC reported hospitalizations to go along with Wednesday's reported year high of 605 emergency department visits. That's one of those places that tends to do worse in the summertime. Wisconsin, I have to zoom this out so I can see it. Wisconsin reports 208 new positive tests, a test case positivity rate of 6.4%, up from 4.9% last week, and 1 death reported by the CDC data tracker. All right, here's the grand totals. The CDC reports a national test case positivity rate of 8.6%, up like a bullet, he says, from 6.5% last week, a 32% increase from last week's national positivity rate. Wow, that's ridiculous. 5,803 nationally reported COVID-related hospitalizations, an 18.62% increase from last week, and the CDC data tracker, now I have to zoom this in so I can see it, CDC data tracker added 216 deaths since last week and now shows 1,230,697 total COVID deaths since this all started, up from 1,230,481 it was showing last week at this time. So some big increases here. And my question would be at this point, I mean, the COVID surge is going to continue through all of August. Some places such as Florida could be peaking right now. A few other places will peak earlier. The national peak, my best guess would be probably either the first or second week in September. We are going to see some places peak earlier, but it's not going to just go straight down. We're going to see this back to school. It's going to extend things a little bit in some areas. And then once we get to about the second week in September, we should see things dropping for COVID, or hopefully dropping. A wild card remains with XFG.3 COVID variant. Does that cause something of its own? I don't think it's a whole lot different than XFG. Honestly, I don't know. But the point is, we'll probably see some sort of a fall lull. I don't know how low that is going to get. But right now, we're clearly not at that point yet. We're still rising. and many places, especially in the north. This is when the north is now going to start to pick up the pace, as the south has been doing so for some time. It's really a risky period right now, so please take your precautions. Maybe you're a person that has not masked in a while. Good time to start doing it again. Alrighty, folks, that does it for the Saturday edition. A very long Saturday edition of the Virus Update. If you like today's update, give it a thumbs up. If you're new here, subscribe down below. Hit that notification bell. Share this video with anyone you know. Leave your comments down below. And if you want to become a member of the new Data Report fan club, there is a link in the description to do so down below, and all the details will pop up about that. Alright, I will see you again tomorrow. Until I see you again tomorrow for Wastewater Sunday and whatever else I find, stay safe, everyone, and have a fantastic Saturday afternoon. Thanks for watching.